Hey, thanks for joining us. Appreciate your coming in. I want to thank all of the folks in this room who care so deeply about the future of mental health services in Vermont. We have an opportunity in Vermont as a result of Irene to ensure that we rebuild this state better than the way Irene found us. That means residents get back into the homes, we get them back so much what they lost, that we grow jobs and economic opportunities by ensuring that Vermont's businesses don't get taken out by Irene. We also have a golden opportunity to ensure that we deliver to Vermont's most vulnerable citizens, our mental health patients in Vermont, the best quality care of any state in the country. We all know that the facility that we were using for the state hospital pre-Irene, the bricks and mortar, did not dignify or allow for quality recovery because the buildings were so dismal. As I've said before, if you took me as a happy, healthy Vermonter and placed me in the old state hospital, the quality of care was extraordinary and the building was so bleak that I would have emerged depressed if I'd gone in happy after 30 days of living there. That's why the federal government condemned the bricks and mortar of the facility. So we have an opportunity now. This administration has been working tirelessly with the extraordinary mental health community in Vermont. Our community providers, our hospitals, our designated agencies, the Brattleboro Retreat, to come together with a plan that will ensure that we deliver quality mental health services to Vermonters for the next 100 years. That's our opportunity, and that's the opportunity that we're seizing today to outline the plan for the future. This is not about bricks and mortar. This is not about politics. This is about coming together, all of us, to ensure that we have one thing in mind. How do we take Vermonters who are struggling with mental health issues and get them quality, preferably community-based care, wraparound services, the support they need to ensure that they have a healthy and happy recovery. That's our goal. As you know, we've worked tirelessly to put together an interim plan given the fact that we had to leave the state hospital on short notice. Let's put it that way. I've made very clear that the opportunity is we will never go back to that facility. We must never go back. So here's the plan that we want to outline to you for the future that will ensure that Vermont is, in fact, the best state in the country to ensure a healthy and quick recovery, good quality care. We will build a 15-bed facility in central Vermont to ensure the good work that we've provided, the good quality care that we've provided by the state of Vermont for those that need intensive inpatient beds. That facility will be built in central Vermont, near Central Vermont Hospital. I'm going to ask the legislature to work together with my administration to get that building up, built, and opened as quickly as possible. We will begin by building a 15-bed facility, because that's what we believe we need. However, it will be built and designed on a piece of land that is expandable and can be made larger when necessary or if necessary in the future. Why do we believe that we don't need more than 15 beds now? Because we've come up with a geographic distribution of services that we think will serve Vermont better than the model that we had in the past of one hospital in one location. That is the 15-bed facility that I just mentioned, very close to Central Vermont Hospital. The second is 14 beds provided by the Brattleboro Retreat. We also have entered into a partnership, will be, with Rutland Regional, and I want to thank Tom Hubner for being here today, for 6 permanent beds in Rutland. That will serve the Rutland community well as Bennington County and other communities nearby Rutland. We will have up to 5 beds, secure residential beds, on the campus of the Windsor Correctional Facility, which will allow us to serve patients there. That's the plan. 15-bed facility in central Vermont, built as quickly as possible, with expandable potential for the future if and when necessary. 14 beds permanently in Brattleboro, 6 beds permanently in Rutland, and up to 5 beds permanently Windsor Correctional Facility on the beautiful campus there that we have. In terms of dollars and cents, the capital costs for this are roughly $26.6 million. We do believe that we will, with a combination of insurance policy from the Waterbury complex and the help of FEMA in this time of crisis, that some, and under the best scenario, almost all of this build-out could be covered by federal dollars and insurance dollars. Whatever the breakdown is, we must get it done, and we must get it done quickly. Additionally, to ensure that we have the wraparound services, the community care that Vermont has committed to for many, many years, but hasn't always followed through, we're going to have additional what we call step-down beds to make sure that we have transitional beds for our most acute care patients. We're going to ensure that we have improved emergency services, and we're going to fund it. We're going to ensure that we have improved individualized services, housing vouchers, and peer services, which are working so well right now in the community care model. So that's the vision. That's the cost. I want to thank our partners, our community care providers, and I'm going to have Floyd Neese speak about, for the Vermont Association of Mental Health and Addiction Recovery. I want to thank the Hospital Association, B. Grouse, and all of our partners there. And Julie Tessler, is Julie here somewhere? Yeah. Julie Tessler, thank you for your good work. And to Todd Centerbear from Howard Center, we're going to start out by letting Floyd Neese say a few words. Where is he? Right here. Thank you. Nice suit. That's the one you got in Taiwan.
This is the second one, yeah. Hi, thank you, Governor. So I'm here today because as important as it is to say something as an advocate when you find administrations doing something wrong, it's equally important to say something when they're doing something right. The Vermont Association for Mental Health and Addiction Recovery believes that Vermonters with serious mental illness need to be treated as close to home as possible, in the least coercive way possible, and in a way that integrates their mental health care with their physical care. This plan, if executed well, promises to do that. As we go forward, it's going to be important to watch carefully the implementation of the plan. And there are a couple of things that will be sort of the canaries in the coal mine. One of them will be the population, the corrections population of people with serious mental illness, and whether that continues to grow. And another will be the care management system that's put in place. It seems to me that there is no plan going forward that can succeed without a really effective care management plan. And I know the administration is looking at how to do that well. They're looking at other states, and we look forward to monitoring progress as time goes on.
Thank you, Floyd. Who's back next? B. Grouse, Hospital Association. Thank you for all your help.
Thank you.
I just want to say a word about the hospitals that I should have mentioned is, in terms of the transition, in terms of the crisis, we've had a lot of partners come up to the plate, but I want to thank the hospitals, Fletcher Allen, Rutland, Central Vermont, for their and all of the others that have been so helpful. Obviously, Dr. Retreats, one of our hospitals, for their extraordinary cooperation during this transition.
Thank you. Thank you, Governor. Also wanted to thank Governor Shumlin and also his team, Christine and Patrick and Secretary Racine, for their help and assistance from day one. We have been working with them to make sure that patients got the care that they needed under very, very difficult circumstances. We certainly support the Governor's plan. We know that there is a lot of work left to be done. Ultimately, The work that we complete in our mental health system has to become part of our overall health system, and we believe that this work is an integral and very, very important part of our overall healthcare reform efforts. So we're very appreciative of it. And I know that we have Tom Hubner and Rob Simpson and others here who would certainly be happy to add their comments on what they are doing. Thank you.
Julie, Tesla, and then Todd and Rob.
The Vermont Council of Developmental Mental Health Services also appreciates the process of how we got to here. It's been very inclusive, included both peers as well as providers, people who work in the hospitals, individuals involved in the mental health system in all different ways. We also look forward to the dialogue with the legislature because there's a lot to work through still, and it's going to be a very important dialogue coming up. The goal is not just to replace the Vermont State Hospital, but to have a robust public mental health system. A mental health system has three components. The foundation of that is the community-based system. And to have a system that's accessible to the people who need it when they need it. Like health care, you want to be able to have people access prevention and primary care, and we need that in community mental health. So we need to have peer-based services, outpatient services, case management available for people who need help getting what they need, mobile outreach and crisis teams that can meet people's needs in the community before they go to the emergency room, and a range of residential options. We've gotten a lot of support for that. And importantly, I think we're learning that we can meet the needs of people in community residential options that might previously have gone to inpatient care. Not everyone, but some people, and that's very exciting, and we're really pushing the envelope and learning there. We do need a combination of both community hospitals and a specialized facility, and we do need the care management system that Floyd referenced that makes sure people get to the level of care they need when they need it and have those choices. So you don't want people going to a higher level like inpatient care if they could use a community resource. And as their needs change, you want to help them get to where they need to be. So you put that together and you have an effective system of care, and we're very excited that we're moving in that direction. Thank you.
Thank you, Julie. Todd, you want to add a few words? Thank you.
This plan can be successful. And I won't repeat what others have said, but I applaud the administration and all our community care partners in the hospitals for really taking the risk and pushing the envelope in service of people really who do need care. I'll simply say that ultimately, though, I think the success will not be based on what we finally determine is the right sizing of beds or the robustness of community care organizations. It will really depend upon what someone said who's much more eloquent than I. The question is not can we all but move away from what we have defined in the past as institutional care. The question is really can we find places in our hearts and in our community to serve people and welcome people home. And that ultimately will be the underpinning, I think, of what our success will be as we engage in, no doubt, robust discussion about what those principles are that really undergird the kind of communities that we really want to have in this state.
Thanks, Todd, and thanks for all the great work of the Howard Center. We appreciate it. I want Rob Simpson from the retreat to say a few words. Before I do, I just want to thank the retreat and our extraordinary state employees for the quality of care that they've been providing in this transition, and I know that they'll provide in the future. When we talk about the state hospital and we talk about the shortfalls there, I want to make clear we're talking about the bricks and mortars of an aging building that should have been moved out of some time ago. We have extraordinary quality care provided by our state employees. I'm proud of the work they do. I'm proud of the work they're doing in a partnership with the retreat right now, and happy to introduce Rob Simpson.
Thank you, Governor. I just want to say from the first night, August 29th, when I greeted the busload of patients from Vermont State Hospital and the employees on the bus, one thing was immediately clear to me, that the phone calls that followed from Todd Sinnebear, from the Governor, from Tom Hubner, from B. Grouse, from Christine Oliver, I mean, we have been on the phone and in contact with each other almost daily, multiple people throughout this state. It's absolutely clear to me that the patients are first and foremost in everybody's mind, And I'm delighted to also thank the Vermont State employees who got off that bus, went to work with our employees, and have spent the last 2-3 months with us, helping us understand all the concerns that the state hospital patients had, and have helped us make a more robust system. So I'm very pleased to have the honor and the opportunity to be part of this system and to work with all my partners around the state. So thank you, Governor.
Thanks, Rob. Appreciate all your help. We'd be happy to answer questions if you have them on this subject.
You do. So this essentially abandons the idea of the larger centralized facility that a lot of people have said is the better way to go, and it would make use of the core of the state employees.
I think abandons is probably the wrong word. What we're doing is building one smaller state facility that can be expanded in the future if and when necessary. But I think it's really important to reemphasize what both Todd and Rob and Julie just mentioned, Envy. We have an opportunity here to provide community-based care to patients that mostly want to be treated in their home communities. And that's been the vision going back for several governors. We have not adequately delivered. We have not adequately delivered on that vision. So the opportunity from Irene is to ensure that Vermont finally provides the resources for community-based wraparound services, local care, that we use our acute beds whenever we need them, that we're scattering them more thoughtfully around the state so that people can receive services closer to home, whether it's for wraparound services or for the most intensive care necessary. This allows us to deliver intensive care in Brattleboro, in Rutland, in Windsor, and in central Vermont. That's a huge improvement, in my judgment, over the quality of care that we were able to provide in the past because it keeps people closer to home.
How do costs compare?
Well, we have to remember that for the last decade or so, we have been decertified by the federal government, and therefore Vermont taxpayers have been shelling out about $10 or $12 million every single year because we have not qualified for the federal match that almost every other state in the country qualifies for acute mental health services, a 60% federal dollars for 40% state dollars. So we believe that this model will be more affordable for Vermont taxpayers and be better quality care. I want to reemphasize, this isn't about politics, this isn't about brick and mortar, this isn't about money. The first priority is Vermont's going to be the best state in the country to get quality care when you need it in a mental health profession.
Does this have to be reviewed by the feds before they fund it, or they're funding it now, aren't they?
No. Well, yes. They are in a transition.
Yeah.
So let's be clear. They were not funding it until Irene. Now they are. Where the rubber hits the road with the federal government is not so much with the Secretary, but with FEMA. I am doing all I can, and I know my entire team is, Secretary Spalding, Neil Wonderville, Larry Cassidy, and others. We are begging FEMA to help us build this transition, during this transition. And they've been quite open to discussion of helping us to make some contribution to a new facility instead of rebuilding in a floodplain. So that's the argument we're making to the federal government, and we're hoping that FEMA will help us build the new facility.
But in terms of this sort of decentralized model with one smaller facility in central Vermont, does that have to go through CMS review?
We don't believe there are any obstacles to CMS approval. We believe that this entire model that we've laid out will qualify for 60% federal dollars and 40% state, and that will be a savings to Vermont taxpayers, we believe.
You say this provides community care closer to home for the patients, but what does it mean for state hospital employees that have been in Waterbury?
Well, when we want to build the Central Vermont facility as quickly as possible. And obviously, that is going to require the extraordinary care that we've received from Vermont state employees. We don't know exactly what the long-term implications are of running a smaller facility as we enter into agreements with various organizations that we've just mentioned that we're partnering with during the transition. Obviously, we want to keep as many state employees on the job as we possibly can.
Can you ensure job security, though?
Sure can. This governor and this administration is focused on jobs every single day. And we're making progress. Just want to point out, Shumlin County has the 5th lowest unemployment rate in the country. We're making progress. Vermont has among the lowest in the country. We're making progress. We want jobs for everybody.
Will fewer state employees be needed under this plan than the one that existed before Irene?
Quite possibly, because it's a smaller facility, but again, we do not know the answer to that question yet.
How long will it take to build the facility?
I'm hoping that we can use the example of rebuilding 500 miles of roads and dozens of bridges in 3.5 months for 25 cents on a dollar and apply it to the construction of this facility. We want this to be a beautiful facility, state-of-the-art, well thought out, and put up quickly. And we have a couple of locations up near the Central Vermont Hospital that we think would work. And we're going to be working together with the chairs of the committees in this room right now, with the Speaker and the Senate President, to get this approved as quickly as possible. We want to be breaking ground as soon as we can.
Do you own land yet?
One of the parcels that we're considering, we do own. We're considering some nearby land to it that would make the site even more desirable, in my judgment. The other one that we're talking about, negotiating with, we don't own, but we could and we would.
So the best case scenario then for grand opening might be?
Well, I'm not going to speculate on that yet. As you know, government sometimes moves more slowly than the private sector. I'm hoping that I can bring my private sector experience and some experience doing real estate to this job and get it done quickly.
Year, 2 years, 3 years?
3 years would be too long.
What happens in the interim?
Well, the interim plan is working effectively, and let's be clear, as we invest in the infrastructure for 6 permanent beds in Rutland, we're going to make that investment as quickly as we know how. Right now, the Brattleboro Retreat is providing services for up to 25 of our patients at times. But we're going to be making the investments there because that's a transition, part of our transition. Both Rutland and Windsor and Brattleboro are part of our transition. So we can invest those dollars now, get those programs up and running, and they will serve us long into the future.
Does it have a new name?
Does it, what have a new name?
The new facility?
Not yet. But a few suggestions were...
Oh, as opposed to the Vermont State Hospital?
We haven't gotten that far yet.
Does the decision to have
It's an interesting question.
14 beds in Brattleboro, 6 in Rutland, as opposed to a larger facility in central Vermont, is that based on the amount of time it's going to take to get those beds in place, the cost of those beds, or was it based on a clinical evaluation of what's best for those patients?
We designed the model that we think would make Vermont cutting edge, best delivery of mental health services in the state. And we believe that this model is what is called for, a movement from centralization, although we'll still have centralization where necessary, to quality, community-based care where wraparound services are provided to the least acute patients right at home, and obviously the more acute have beds to go to move them back into their communities as quickly as possible. That's the wave of the future. It's no different than when I talk to my parents about their health care in the future. And what they say is, whatever happens, we want to be at home. We want to be in our community. Mental health patients are no different. They suffer from disease like all other Vermonters, and they want to be treated for those diseases as much as possible in their home communities, and this model provides for that.
Who on your decision-making team was evaluating things from a clinical perspective, taking that lead role?
Well, this has been a group effort, and I want to make clear, this isn't just the administration. This has been a partnership with all the people that just spoke, our community care providers, our hospitals. We have involved more people in these discussions to get a decision quickly, and you'll see many of them assembled around this room today. So, we're using both clinical and visionary judgments that we think are going to work.
The reason I ask is because the medical director at the Vermont State Hospital offered testimony to lawmakers this morning that seems to fly in the face of what this model is. He's saying you need a standalone facility with 48 to 60 people in order to be able to deliver this level 1 care. Was he
48 to 60 beds or people?
Yeah, beds. Was he consulted in these?
You know, I obviously haven't been involved with exactly who's consulted because I'm juggling a lot of balls in the air. All I can tell you is you will never see a governor come forth with a plan for integrated mental health services in Vermont where everybody is jumping up and down saying, wow, that one got it right. What we can tell you is that this has been a collaborative process where we believe that we're making the best judgment for the patients of the state of Vermont. And that's the best you can ask of us.
With adding beds to hospitals around the state, will certain types of, I guess, specific floors or separate areas particular to the type of care also be constructed?
Well, I'm going to let Tom Huebner give you a vision of what he's doing down in Rutland as an example, if that's okay. Do you mind, Tom?
Not at all. So in Rutland, we've had an inpatient psychiatric unit for many, many, many years. And when the the flood happened, initially we were not had patients transferred because we're actually full. But immediately thereafter, patients began to be admitted to our hospital, and our clinical team, led by Dr. Gordon Frankel and Jeff McKee, who are here today, began caring for them in, frankly, extraordinary circumstances and very difficult circumstances. We believe from the outset that that could not continue in that way because it's a very small footprint of space, and it doesn't work terribly well to have this population mixed with the other folks who we're caring for. So we've been pressing hard to come up with a plan, and in Rutland it means that we're going to take the adjoining rehabilitation unit and create a 6-bed intensive care, psych intensive care unit next to our other unit so that patients can move back and forth as they need different levels of care. And our rehab unit will move downstairs to the 3rd floor. So for us, it was really doing something out of our original plan, but frankly, I think like the governor, we saw Irene as an opportunity to make some lemonade out of some lemons, because the state we've been in for the last decade and more really hasn't been at all good. There are no perfect solutions to this. There just aren't. And I said to the governor some weeks ago that it would take courage to come up with a solution that would work for Vermont, and that if he did, that he would have my support, and he does. Because this is important we move forward knowing that there's no solution, as the governor just said, that's going to please every person here that's also doable. So speed does come into it. We need to move as rapidly as we can because we're asking clinicians right now to do things they're not comfortable with in spaces that are inadequate. So time is of the essence, and that is part of the equation and part of why this plan, I think, emerged as it did.
Well, that's something I wanted to ask about, too. You said this is asking clinicians to do things they're not comfortable with. Are you going to have more staff that is more comfortable or new training? How is that going to work out?
What's making them uncomfortable is not their training or not their skill levels. In fact, our staff has been extraordinary and has been augmented by state employees who have done a great job. But we're mixing patients of different needs in the same milieu, and that's what's been so very difficult. Having said that, if we add 6 more beds on a permanent basis, sure, we're going to need some additional staff. And there's certainly some wonderful state employees who are working down with us now who we'd love to have continue with us if that's of interest to them and this moves forward as the plan suggests.
Rob, do you want to comment on your hospital's end of how you're dealing with Susie's question?
I would agree with what Tom said. Our staff are not uncomfortable by virtue of training or skill set. That's not the issue. The issue is making sure we have the right environment in the unit to do the work that needs to be done. These are complex patients. The acuity levels tend to be high. And we need spaces and environment of care that suits and fits that spectrum.
Why not reopen the top 2 floors of Vermont State Hospital now that you have a solution in place? State Hospital wouldn't be permanent, and then maybe alleviate some of these crisis situations that we've been hearing about from doctors all over the state.
I take very seriously that we were putting our most vulnerable citizens in a space that wasn't fit for their treatment. And I do not see any reason why we would go back into a space that we agreed wasn't serving our patients well before Irene. So I've never seen progress made by going backwards, and I don't think we should do that now.
So is it just kind of a tough it out now until all these new
No, let's
things
be
are in
clear.
place?
Let's be clear. What this plan allows us to do is make permanent investments now, as quickly as possible, in Brattleboro, in Rutland, in Windsor, to ensure that we're in a better place in terms of bricks and mortar than we are today. We can make those investments right now, and we will. The only project that's going to take a little more time is part of this, and the community-based care, the wraparound services, more second springs. All of that is part of build-out that we can do immediately as soon as the legislature gives us permission. The only part of this plan that's going to take a little more time is building the 15-bed facility in central Vermont that can be expanded, and that obviously will take more time than the rest of this plan. So 3/4 of the plan, roughly, can be executed as soon as the legislature gives us the green light. The rest will be done as quickly as possible. It's the 15-bed facility in central Vermont.
So where do the people who would need that secure facility go now in this transition?
Well, I mentioned earlier that maybe I'll let Patrick actually answer that question in terms of math, but what I mentioned earlier is that, as an example, right now the Brattleboro Retreat has, or at least as of last week, Peter, correct me if I'm wrong, they have 25 patients there. Yeah. You can see in this plan they are going to have 14. So Rutland is taking many. Don't forget Fletcher Allen. It's been extraordinarily helpful. So we have a lot of partners in this process that are going to help us get to where we need to go.
I'm nervous when the governor tells me I'm in charge of math, but the answer to your question, I think, is that we haven't mentioned as part of the interim plan right now that Fletcher Allen is also taking a unit at the hospital and serving the same population, so that besides what's going on in Rutland and at the Brattleboro Retreat, we do have, and the Fletcher Allen has agreed to continue to provide 7 to 10 beds for this population in the interim period. When the state hospital or the state facility is built, then Fletcher Allen will revert to business the way they used to conduct it. But in the interim, they've made that commitment for us as well, which they're doing today. In fact, I was up there the other day and was told they actually had 11 patients on the unit. So they're stretching themselves as well. They're not asking for capital construction, but they're going to stretch themselves as well during this interim period.
So is the idea of the facility in Williston, Pine Ridge, is that off the table then?
Pine Ridge didn't, frankly, work out the way we thought that it might. The buildings, when we looked at them more carefully, weren't as ideal for transitional beds as we thought they might be. It's not entirely off the table, but it would be an unlikely development at this time.
Were you on board with the futures plan as it existed before Irene? Did you feel like that was a good place for the state to be headed?
I think the futures plan had a lot of strengths. My concern about this whole issue has been that, like so much of state government, there's a lot of studies, there's a lot of talk, and change doesn't happen. We have an opportunity now to build the best state-of-the-art mental health delivery system in the country. We're doing things here, making proposals here, that really will allow us to deliver, to treat our mental health patients the same way we treat every other disease. Keep them home and give them quality care unless you absolutely can. That's what we do in the rest of the delivery system, and that's what we intend to do here. I just think it's really an exciting development for Vermont.
15-bed facility would be owned and operated by the state?
That's correct. It would be no different than the old state hospital, except it's going to be a state-of-the-art, beautiful, light, energy efficient, happy place to be.
With Pine Ridge off the table, what is the current plan for step-down beds?
Mr. Secretary, do you want to hit this one, or Commissioner? We're doing a lot of talking. Come on, take it away.
Oh, go ahead. As far as the step-down capacity right now, Second Spring has increased their capacity from 14 to 22. We are also working to develop additional capacity that we hope will be online within several months.
Could you talk about Windsor and forensic beds? You're planning to build a new facility there as well?
Yeah, do you want to take that?
Sure, I'll try.
It's not entirely a new facility. We're adding some beds for this purpose. So we're doing it now, and we're going to continue to, but in better facilities.
Secure is different.
What we hope to use the Windsor facility for is more of a long-term, secure residential setting. Some of you may remember that proposal been made a couple of years ago, and that subsequently was taken off the table. But there is a need for certain people from time to time to have a secure setting for a longer period of time. They don't need the hospital anymore. And in fact, some of the people that were stuck at the Vermont State Hospital were people who needed a secure residential setting for a longer period of time. So we're hopeful that we can renovate it's a small unit on the property of the Windsor prison. It's separate from the prison. We think it would be suitable for a small, secure residential unit for people. Now, that need can vary from 0 to, we wouldn't use the facility for probably more than 4 to 5 people at a given time. So it will be small, but it'll be secure residential, not so much forensics per se. I mean, the forensic issue gets complicated quickly in terms of what those needs are. But the Brattleboro Retreat right now is handling forensic patients. Those are people that have been, charged or about to be charged and are sent to a hospital for evaluation. By far, most of those people can go to a regular hospital and get their evaluation. It's only a very tiny number of people that are in that situation, but also need a highly secure setting. So, just to be clear, the Windsor facility is aimed more at people who are past the acute stage and need a long-term acute setting. In the meantime, the forensics are being handled primarily by the retreat.
If I could add just a couple, just a background on that, Governor.
It's a narrow range of these cameras.
Right. Well, I don't need to go.
You've got a beautiful face.
Just background. Those secure residential patients have been in the Springfield Correctional Facility for the last little while, and they're actually in correctional facilities. And as a matter of fact, they're taking up a whole wing that is making it so that we have to send more corrections patients out of state. The Windsor facility, I just wanted to point out, is it's a beautiful location, a lot of land. It's a minimum security facility, and what we're talking about here is renovating a building that's set off from the minimum security correctional building. So it's a separate building right now, and it will be not part of the correctional facility. So I just wanted to point out that as opposed to where they are now in the Springfield Center, the idea here is to take a piece of a building at that location that's already owned by the state, and that we can renovate and bring up to standards for a long-term, interim and long-term assistance with that select population. So just in terms of informational purposes.
Thank you, and that just reminds me of how proud I am and how grateful I am to my team, to Secretary Spaulding, to Secretary Racine, to Deputy Secretary Patrick Flood, to Commissioner Oliver, and to the entire team. Really, all they have done is work really hard and reach out to the providers, consumers. We all had a meeting with many consumers, providers, community-based caregivers, our hospitals, recently where I just sat and listened. But this has been a collaborative process, and I think that good progress comes out of collaboration, transparency, and imagination, and a determination to get some tough things done. And there's no question that this state hospital has needed leadership where we're going to get some tough things done. Not everybody's going to be happy. You in the press will be able to find plenty of people who will beat us up on the second paragraph of the story. But we're going to get this done. We're going to do it right. And I thank my team for helping today.
Can you just clarify one thing? Patrick sort of alluded to it there, but what is the difference in the level of care between these 4 facilities? Is the central facility the level 1, the most acute, and others are?
No. Really, I would describe it this way. The new hospital, Brattleboro Retreat, and Rutland will all be able to provide the same level of care. All of the other pieces of the puzzle will be for less acute patients, and we're going to move our patients from acute care into the community-based care, into the wraparound services, into the peer services as quickly as we know how. And that's really the difference. That's where the rubber's going to hit the road.
Can you just give us the quick breakdown on this 26.6? What's 15? What's the new facility going to be?
a math problem.
Hold on. Let me turn to my math page. So the way it basically will break down, we think, and this is an estimate, is that the new hospital will cost roughly $15 million, 15 beds. That's a very rough estimate. Obviously, we haven't designed it. We haven't talked to our architect. We haven't talked to our construction teams and so forth. But roughly $15 million there. In Brattleboro Retreat, we have a $4 million capital improvement plan for 14 no-reject beds. Rutland, we have a $6 million capital improvement plan for 6 no-reject beds. The Central Vermont Medical Center has proposed a $1.8 million capital improvement to add 4 general inpatient psychiatric beds that we're looking at. The Windsor proposal that you just heard about is about $1.6 million, and that gets you roughly where you need to be.
Are the additional community services going to come out of Christine, come from the proposals that you heard from various people 2 weeks ago or whatever it was?
Right. All those proposals that we heard about are on the table, and we're now in the process of plugging those into an evaluation tool to help us look at. We knew all of them would not go forward, and we'll be picking amongst those that we have before us.
And is it possible that there could be that package could include proposals that weren't a part of those 2 days of presentations?
Well, we certainly haven't shut off anybody from coming forward with the new ideas. We are certainly always receptive to that, but we will be making decisions about projects going forward.
In your estimation, is this clinically the right plan for mental health patients who are, in crisis situations to have this geographic distribution?
Well, certainly not speaking as a clinician, but based on the information that I have, we believe that this plan can get us to what Vermonters need for a mental health system.
Excuse me, I had to pull the governor for another meeting, but we'll stay and field some questions.
Let me just go, Peter, back to the math. So what I just gave you in terms of numbers, just so you know, is $28.4 million. I don't want to see headlines, governor can't have. Thank you so much. We're going to leave the rest of the team here to help you out.
You answer one question before you run about LIHEAP. You
Sure.
had a conference call earlier. Can you just update us on where that effort stands?
Sure. I'm grateful to the other governors around the country for joining me on a call about the LIHEAP crisis. Listen, we live in the wealthiest nation in the world. Oil is higher than it's ever been, roughly $4 a gallon. The question for Congress is, are you going to go home for your holiday break knowing that you inadequately funded a program for low-income people, Americans that live in cold states, for disabled Americans of low income that live in cold states, and allow them to freeze in their homes this winter? Or are you going to have the basic decency and good judgment to ensure that you do what past Congresses have done and give us adequate funding to keep Vermonters and Americans in cold states warm? The math is extraordinary. Right now, we've had enough funding for LIHEAP. All they've allocated is 1 tank of oil for our recipients, and the program is done. We've spent all the federal money we've been sent. So my message to the other governors, my message and the message from the other governors in the country is, Congress, give us a holiday present worth celebrating. Fully fund the LIHEAP program. At the very least, give us the Senate level that Senator Leahy and Senator Sanders are pushing so hard for. That will allow us to keep Americans in cold states warm this winter. Let's not let anyone freeze in their home.
Governor, if I may, in the well of the House right now, 3 committees are meeting, and at 1 o'clock we'll be hearing from consumers and people. Actually, also on 2 committees because one of us up here, but on the whole LIHEAP issue, so you might want to go there.
Thanks.
And if I could, I actually would suggest we move to the informal part of the presentation, because we've got a number of legislative committees that are here that may want to talk to the press, but get back to their legislature. We have some of the clinicians that are here from Brattleboro and Rutland, in case Peter or somebody else wants to pursue his medical questions. And so it's just a suggestion. I think there's a number of people that might like to talk to the press.
I just want to mention, while we have the family together, If anyone wants their holiday tree decorated, see John Dillon. He can do it with one arm tied behind his back. Thank you so much for joining us.